Hello friends, welcome to our channel. Today we're going to learn a very important topic that is instrument in ophthalmology. So ophthalmology के वाइवा में एक टेबल होता है instruments का. So I will try my best to make you guys understand the most common instrument that I use in our minor OT and OPD and which are asked in Viva. So let's start without wasting any time. First instrument which we're going to learn is the Chalazion clamp. So first, if instrument is handed to you, first you need to identify the instrument. So this is Castroviejo clamp, and then you have to describe about the instrument. Castroviejo clamp is having the two plates, two oval plates. One is fenestrated plate or the ring plate, and the other is the solid plate. And there is the uh, screw mechanism to tighten and fix the instrument. Next question, how we use this instrument, and question will be like what it does. So function of this instrument, the function of this instrument is to fix and stabilize the eyelid, invert the eyelid, which is like turn it outward, provide the homeostasis, like reduce the bleeding. Where we use it, we use in the excision and in the curettage of the Chalazion. How we use it, we give local anesthesia, we apply the clamp in such a way this fenestrated or the ring portion is on the Chalazion or the conjunctival side, and the solid plate will be on the skin surface, and then we put the incision. Viva question will be asked, which kind of incision do we put vertical incision, never horizontal. Then we curate out the content of the Chalazion, and then the clamp is released. So after describing the instrument, now the examiner will direct your viva towards Chalazion. So what is Chalazion? Chalazion is a chronic painless swelling of the eyelid caused by the blockage and the inflammation of the meibomian gland. So it's a painless swelling of eyelid. Examiner may ask you what are the painful swelling of the eyelid. Then you have to answer stye or the external hordeolum. Now, examiner may even ask you differentiate between the Calazion and the stye. So the difference is the Calazion is firm, non-tender. There won't be any pain. It's and slowly progressing, and it won't be crossing the lead margin. But in case of the stye, it's very painful. It is tender and it is bacterial infection. And in case of Calazion, it was sterile. It was just the inflammation of the meibomian gland, and the gland which are involved in stye is also different. In stye, not meibomian gland is involved. It is disease, also known as the mole gland, is involved. So this was the Viva question which may be asked from this instrument. And I have mentioned we use this instrument for the curate incision and the curettage. How we curate out this substance? There is another instrument that comes to our second instrument that is called Calazion curate. नाम में लिखा हुआ है Calazion curate. So it is in curate. It is used to remove the content of the Calazion during the INC incision the curate. So now we have completed our two instruments, Calazion clamp and our curate, Calazion curate. Now let's go further. Now we'll talk about the eye speculum. We have three most common speculum over here. Starting with first, Alfonso pediatric speculum. Second one is our universal adjustable metallic eye speculum, also known as the Lieberman speculum. Third one is our Baracus universal wire eye speculum. Baracus is very common. It is usually put in our instrument Viva. So remember about all these three eye speculum. So what are the use? Once you have identified these are the eye speculum, you have even named the eye speculum. So now the use of the eye speculum. Eye speculum is used to keep the eyelids apart during the eyeball surgery. What question may ask, which type of surgery? For example, pterygium excision or the corneal surgery we even use this instrument for the OPD procedure such as foreign body removal. So this was about the eye speculum. Just give the normal name, like just give the basic name. It is like metallic eye speculum or the wire speculum. Then if examiner will ask you what is the exact name of this speculum, then you can say Lieberman in case of the universal or Baracus. So try to keep your viva very simple. Examiner may ask you what are disadvantage of this eye speculum. So disadvantage of this eye speculum, it doesn't have the guard. So if there is no guard in the eye speculum, such for that the eyelashes may come into the operative field. So this is the disadvantage of um, eye speculum. So now let's go further. Now I'll talk about the needle holder. Yes, needle holder are used to hold the needle during the suturing. We have majorly three type of needle holder. I am mentioning two over here. One is Baracus and Castroviejo. Both of these needle holder having the spring action, and the it is very confusing between the needle holder and the scissor. But remember, scissor will have the cutting action, it will be crossing over. But in case of the needle holder, they won't be crossing over, they will just having stick with each other. So Castroviejo and the Baracus. So Castroviejo and Baracus, how we going to differentiate? The Castroviejo is having the S-shaped locking system. Remember that Castroviejo will have the locking system, which will be like S-shaped. So this was about the our Baracus and the Castroviejo. Third one is the Arugas needle holder, also known as the Steven needle holder. It is large in size and having locking mechanism. It is used to hold the needle for suturing of during the extraocular surgery and the such as the lead surgery. In case of the Baracus and the Castroviejo, we were using it for the corneal, the like fine suturing. We were using it. The Arugas we use in our globe surgery. Even we use it during the passing the our bridal suture. As soon as you say bridal suture, examiner may ask you in which condition, in which procedure do we use bridal suture. We use bridal suture, and why we use bridal suture? We use bridal suture in SICS, small incision cataract surgery, to stabilize the globe in downward position. So this was about the bridal suture. Arugas needle holder, we have completed our three eye speculums. We have completed our three needle holder. One was Baracus needle holder, second one was a Castroviejo needle holder, and Arugas needle holder. Now let's go further. Now we will talk about the corneal seizure. That's why I was mentioning the needle holder and the corneal like seizures are very confusing. In case of seizure, it will have the cutting action. It will be crossing over. So we most commonly we have two cutting seizure. One is our corneal seizure and another one is the Vannas. Vannas will have the comparatively will have the very small size compared to corneal seizure. When you hold both of them together, the corneal seizure size is comparatively larger than the Vannas seizure. Corneal use of the corneal seizure are used in the ophthalmic procedure for using the cutting the corneal tissue. नाम में लिखा है corneal seizure is used for cutting corneal tissue during the anterior segment surgery. It is fine and sharp blade, usually long, usually curved, and it is stronger than micro seizure. It is stronger than Vannas. Corneal incision, keratoplasty, and cutting the corneal tissue, we use corneal seizure. In case of Vannas, Vannas is very fine microseizure. It is used for delicate intraocular or anterior segment work. It is extremely fine and is sharp. It could be straight or the curve. It is used in the surgeries like iris surgery, like iridectomy, iridotomy. We use, so as soon as you say iridectomy or iridotomy, your viva may be directed towards what in indication of iridectomy. In which condition do we do iridotomy? Differentiate between the iridectomy and iridotomy. So this is how the instrument viva goes. You describe the instrument, you tell about the use of the instrument, then you talk about in which surgery this instrument is used. As soon as you say the which surgery do we use, the indication and the procedure of that surgery will be asked in your viva. So this is how your viva goes. So when you are giving viva, make sure you stick with the basic, and you are the one who is directing your viva. You should not just say everything you know about like instrument in just one flow. Make a pause. Direct your viva. It's in your hand. Giving viva is an art. It's easy. Once you know, you are not supposed to just say everything you know about the instrument. Take a pause. Like let the examiner ask you the further question, and try to direct your viva in such a way like you know what are the next question they're going to ask. So let's go further now. We will talk about eyelid retractor. Lead retractor, नाम में लिखा है lead retractor, is used to retract the lead. This instrument is also called as the Desmarais lead retractor. Pull back the eyelid and expose the eyeball during the examination or the surgery. We use this eyelid retractor where when the speculum is like speculum we can't insert, like if the eyelids are swollen we can't put the speculum. Then in that condition, we use this lead retractor. We also use this retractor for the like minor procedure like foreign body removal or the examination of the conjunctiva or the cornea. Tesmer is lead retractor. चलो आगे चलते हैं. Let's go further. Next is our epilation forceps. This is epilation forceps. It is a fine ophthalmic forceps used to already plug the eyelashes. So epilation forceps used to epilate or remove the eyelashes. Now question may ask like in which condition why we do the like eyelash removal. The eyelashes are removed when it is like rubbing with the cornea in condition like trichiasis. Trichiasis is the inward misdirected eyelashes. Dystrichias is the extra posterior row of eyelashes. Madarosis is the loss of lateral one third of eyelash. It is because of the chronic rubbing. The fourth one is the poliosis. Poliosis is the widening of the eyelashes or the eyebrow. So this instrument was handed to me in my last Viva, and these were the question that was asked by the examiner. What is differentiation? What is trichiasis, dystrichiasis, madarosis, and poliosis? So this was the question which was asked to me by the examiner. So direct your Viva, you know, you should be knowing like इसके बाद क्या आ सकता है. Let's go. Evaluation for sub is done. Now we will be talking about the punctal dilator. As you know, we have upper and lower puncta, our lacrimal drainage system, you know, like so we use punctal dilator to dilate the puncta so we can insert our syringing in a procedure like lacrimal syringing. So this is our punctal dilator. It is conical. It's like tape. It's having the conical tapering tip, oftenly double-ended and having the two different sizes. It is used in the lacrimal syringing, probing, and cryocystography and the DCR procedure. When you are giving Viva, you are supposed to identify the instrument punctal dilator used to dilate the puncta. Question asked in which condition, in which procedure, you're going to answer the lacrimal syringing. Don't answer the probing, the cryocystography, DCR procedure. Your Viva may be divert toward the DCR procedure, and I believe like most of you might not be knowing that much in depth about the cryocystography and all. So just stick with the simple lacrimal syringing. Question may be asked, what is lacrimal syringing? How you perform it? Then you can say it's an sex syringing procedure to assess the patency of lacrimal drainage system by injecting the fluid to the punctum into lacrimal drainage. Next instrument is Castroviejo caliper. Caliper, you know, its caliper is used to measure. So it is Castroviejo caliper used to measure the corneal diameter, pupil to limbus distance, pupil size, or intersuture distance. It is like marking measurement in like cataract surgery. We want like precision to measure. We have this instrument to measure accurately. Question may ask in which unit do we this instrument like measure. In the millimeters we measure, or in centimeter, in millimeters we use. This very accurate and controlled measurement is done. This was Castroviejo caliper. Let's go further. Now we will talk about IOL dialer. IOL dialer is an instrument that is used to like rotate and properly position the intraocular lens. In cataract surgery, when we put intraocular lens and when we want to rotate and we want to place the change the position and the place it properly, we use this IOL dialer. uh, I will like to emphasize on the tip of this IOL dialer. IOL dialer tip will be like hook side, hooks like a hook. It will be like straight and then it will be like a hook like this. Remember, because IOL dialer and the iris repositor look very similar, so it's very confusing. Don't get confused. IOL dialer will be having a curved tip. It will be like hook shaped tip. Look, as I was talking about iris repositor. Iris repositor and IOL dialer looks very similar, but remember IOL dialer will have a hook-like tip. Iris repositor is used to reposit the eye, like iris. It is like blunt. It is non-traumatic. In the surgery like cataract surgery or phacoemulsification or the trauma, when the iris is like position is changed, we use this to reposition and the putting on the normal size. Like its design is very, it's long and the like thin shaft. It is blunt and round tip. So this was about the iris repositor. Iris repositor and the IOL look very similar. Don't get confused, both having a different function. Let's go further. Now we will talk about the Stur superior rectus forceps. As name suggests, superior rectus forceps. We use this instrument to hold superior rectus. Question may ask in which condition we need to hold superior rectus. We hold superior rectus for passing bridal suture. Question may ask why we use bridal suture. Bridal suture we use to secure the globe in down position. Why we secure the globe? We secure the globe in our cataract surgery. Which cataract surgery? We use this in our small incision cataract surgery, SICS. Uh, this was about our Dastur superior rectus forceps. Your question may ask the what are the steps of SICS. So keep in your mind, this is how the Viva goes if the Dastur superior rectus forceps is handed to you. Next one is our Kalman-McPherson forceps. Look, Kalman-McPherson forceps is used to insert the intraocular lens during the cataract surgery. These three instruments. Third one is our capsular axis forceps. It's like fine ophthalmic forceps used to graft and tear the anterior capsule to create the continuous curvilinear capsular axis during cataract surgery. These three instruments, the true superior rectus forceps, second one was our Kalman-McPherson forceps, and third is our capsular axis forceps. These three forceps looks very similar, but they have a unique features. Remember, the S shape will be in the true superior rectus forceps. Second one is McPherson won't be having the teeth will be like not like a hook like teeth and teeth like teeth, but in capsular axis you can see it's like a teeth like in teeth. So this is how we will differentiate between these three forceps. All these three forceps have a different function, so it's confusing, but if you have really study in really depth and you if you see this instrument you can differentiate between all these three. Let's go further. Now we'll talk about the wire vectis. This wire vectis it's an instrument used to deliver the nucleus during from the anterior chamber during the our surgery like SSCS or ECCE. We use this wire vectis to remove the lens nucleus. It is advantage of this instrument is having the like minimum pressure on the cornea. Whatever question may be asked like what is this sandwich phaco technique? Don't say sandwich Faco technique until and unless you are asked to answer it. Faco sandwich technique is a technique in which we use wire vectis and the Faco probe in such that manner that the Faco probe is on above and the wire vectis on the below, and we use this both instrument to remove the nucleus in a sandwich manner, like sandwich, like above is our Faco probe, below is our wire vectis, and we use both of these to deliver the nucleus. So in the to deliver the nucleus, we use our wire vectis. This is the use of the wire vectis. Now we'll talk about the blades which are used in our phacoemulsification. So there are usually we have four blades I'll be talking about. One is our 15 degrees side port blade. As name suggests, naam mein likha hua hai 15 degree. It's having the 15-degree angulation and it's is used for making side port. And why we make side port to for the entry of the viscoelastic substance or the irrigation or aspiration we use the side port. Second one is our crescent blade. Crescent blade will be having an angulation of the 45-degree angulation and it will have a blunt tip. It won't be having any sharp edge, it's having a blunt tip. Where we use this crescent knife, we use crescent knife to make sclerocorneal tunnel. Third one is our keratome. Keratome is diamond shape. It's sharp diamond shape. It is used for the entry of the phaco probe. Remember, keratome, phaco probe, or the IOL insertion. Last but not least is our MVR blade. MVR stands for microvitreoretinal blade. It will be shaped. All the three earlier was having angulation 15-degree, 45-degree, or different angulation. But MVR blade will be straight. It will be triangular. It is used for making side port incision. Understood? Four blade. First one was 15-degree side port. Look, 15-degree side port blade. Second one was our crescent, 45-degree, used to make sclerocorneal tunnel. Use is keratome. Keratome is used for the phaco probe for the entry of the phaco probe. Last but not least is MVR blade. Is used to make the side port incision. I hope you guys understand this is how the instrument goes, and I have tried my best to simplify all these instrument in such a easy manner that even the Viva question which may ask from the instrument, I have tried to explain. Till then, I wish you good luck. Keep learning. Keep scoring really, really good. I wish you good luck. Take care. Tata, bye bye. And if you have any suggestion, please drop down in the comment section. And I hope you guys subscribe to this new channel and stay curious. Keep learning. Tata, bye bye.